Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition irritable bowel syndrome, the IBS. So, by definition, IBS is also known as spastic colon, spastic constipation, irritable colon, and nervous indigestion. Okay? It is a motility disorder, movement disorder, which strongly associated with anxiety, stress, or depression in over half the cases. Okay, a common gastrointestinal disorder, so it involves the stomach and the colon disorder, involving an abnormal condition of gut contractions or motility, movement in the gut, and increased gut sensation, visceral hypersensitivity, okay, characterized by abdominal pain, discomfort, gas, bloating, mucus in stools, and irregular bowel habits with constipation or diarrhea, or alternating diarrhea and constipation. Okay, symptoms tend to be chronic, okay, intermittent, and to wax and wane over the years. It's like they flare up and then they get get the symptoms are over. The then again it stays chronic, then flare up again, depends on the condition of the patient. Okay, so it's these conditions is a chronic thing. Okay, so it could wax and wane over the years, right? So although IBS can cause chronic intermittent recurrent abdominal discomfort, okay, it does not lead to any serious abdominal organ problems, which is good. So it does not lead to any serious abdominal organ problems. Here you go, guys. All right. Okay, so there are contributing factors. With IBS, there are disruptions and incoordination of the natural peristaltic actions, okay, and mass movements of the colon. So there is what you call peristaltic action. So pertaining to like wave-like movement in the gut, in the colon. Okay, so that's this movement is the one that moves bowel in the colon. Those digested food and water. Any liquid there. Peristaltic movement. Okay. And this may be caused by autonomic dysfunction, so involves autonomic nerves dysfunction, okay, notably with the stress response, right? Next, there may be autonomic dysfunction, notably with response to stress. This disturbs the transit time of the fecal matter, the feces, and results in alterations between constipation and diarrhea. Okay, so when it happens, then you get diarrhea, then you get constipated, or constipated, then you get diarrhea during bowel movement. Okay, so food intolerance affects those with IBS. Figures vary from 6% to 60%. Okay, so common food intolerances include wheat, coffee, dairy products, yeast, and citrus fruits. So such allergies cause motor and secretory dysfunctions in the GI tract, gastrointestinal tract. Okay, so these food products will cause you some intolerance in the GI tract or some allergies. Okay, so just avoid this. Okay. Let's move on to the symptoms. Symptoms are brought on by emotional stress, fatigue, alcohol, and eating, especially consuming meals high in fat, roughage, or fruit. Okay, some people will experience mainly constipation with regular bouts of diarrhea, while others will have the reverse symptoms. Okay, so constipation results in hard stool due to decreased propulsive movement and an increase in the segmental movements in the colon. Okay, diarrhea results from an increase in propulsive movements and a decrease in segmental movements. So these are the two kinds of movements that's happening in the colon. Okay, propulsive and segmental movements. All right, and this reduces the amount of water the body can reabsorb and accounts for a watery stool. All right. There is steady or intermittent pain in the lower abdomen accompanying the altered bowel function. So there's intermittent pain you can feel. Can be dull with sharp cramps, okay? Kind of pain, dull or with sharp cramps occurring after eating or in the morning. It is the result of increased pressure from the fecal matter, the feces, in the colon, accompanied by gas buildup. Okay. Other symptoms include the feeling of incomplete evacuation of the feces. Eliminating pellets, stools is difficult for anyone, even those with IBS. Bloating, nausea, vomiting, anorexia, and halitosis. So, anorexia. Anorexia, guys, is an eating disorder characterized by weight loss. Okay, it's an eating disorder characterized by weight loss. Okay, for halitosis, it is also called as bad breath. Okay, halitosis. So many symptoms of IBS are common to inflammatory diseases such as ulcerative colitis. So these symptoms are also common to inflammatory diseases such as ulcerative colitis, and it's also like the irritable bowel syndrome. It's an inflammatory disease. Okay. Let's move on to part 2, the subjective component. Okay, so you're gonna find this health history, and this will be helpful for you in asking questions regarding the condition in your treatment plan. Okay, so you're gonna ask, how's the client's general health? Okay, so has the client consulted a physician? Does the client have any idea what may be causing this condition? How long has this been present? What indicates to the client that he has irritable bowel syndrome, the IBS? How's the client bowel movement? Is it frequently and consistent? What is the color of the stool? You're gonna ask the client as well. The color of the stool is important. Is there pain? Where is the pain located? What are the quality of the pain? How about the frequency and duration of the pain? What relieves the pain? Is pain often reduced after having a bowel movement? Is pain often reduced after having a bowel movement? You can ask your client this. So let's move on to the part 3 of the objective component of the treatment plan. So you're going to do assessment in this stage. Now for the observations assessment, you're going to do a postural assessment, a gait assessment. So just read on the information here, guys. Okay, you're gonna do gait assessment. So there are a few information here. Just read on the information, guys. Then there's the palpation and range of motion assessment. So just read on the information, guys. Okay, so for the palpation and range of motion, just read on the information, guys. Now for the testing, it includes performance of the rebound test. Okay, it will be negative for irritable bowel syndrome. So you're going to do a rebound test and the result will be negative for irritable bowel movement. Okay, now for palpation, you're going to palpate hypertonicity or tightness of the muscle tone on the affected area, hypotonicity, weakness on the muscle tone on the affected area, of abdominal muscle. It's impossible. So the abdominal muscle is the affected area. Then you're gonna palpate for tightness and weakness on the abdominal muscles. Okay. All right. Now for the techniques, you can use deep tissue massage. You can use lymphatic drainage. You can use PNF, MAT stretching. Stretching techniques, Swedish massage techniques. So you can use all these techniques. Okay, so PNF is proprioceptive neuromuscular facilitation stretching techniques, and MET is muscle energy technique and some stretching techniques as well. Okay, so those techniques you can use. Then Swedish massage techniques. Okay, now let's move on to contraindications and precautions. Okay, so hydrotherapy application of heat on the abdomen should not be used if the client has any history of increased blood pressure or cardiovascular problems. So heart and vessels, blood vessel problems. Also, they would not be used if the client has a flare-up of an inflammatory bowel disease. Okay, so if there's a flare-up, like the symptoms are there, or the client is feeling the problem. Diarrhea is contraindication to abdominal massage. So guys, take note that whenever the client has a diarrhea, if the client comes to your clinic and the client is having diarrhea, it is a contraindication not to do the massage treatment. Okay, so no massage on a client having diarrhea at the moment. Okay, so take note of that. Now let's move on to the part 5 on which is the treatment plan. Okay, so there are goals to follow. So just read on the goals, guys. Read on the goals here. Now let's proceed to the positioning, pillowing, draping, and techniques. So positioning for irritable bowel movement massage is supine and side lying. So you can do supine, which is facing up, lying on the back on the table, face up, and side lying on the side. Okay, that's the position that you're gonna ask your client to position herself or himself on the table. Okay, now for the hydrotherapy application of heat on the abdomen. Okay, that's the one you're gonna do, and so should not be used. Okay, so hydrotherapy application of heat. So no heat hydrotherapy application on the abdomen. It's a contraindication, so you cannot use that for certain heart and blood vessel problems, and if the client has inflammatory bowel disease, any of the inflammatory bowel disease flare up is experiencing the problem at the moment. Okay, so for general treatment, a smooth rhythmic pace is used. So smooth rhythmic pace is used. Okay, Full body rhythmic techniques and effleurage are used throughout the massage. So these are the only techniques you're going to use as a general treatment. Okay. Now for this specific treatment, just read on the information here, guys. Just have to do some of these techniques for your specific treatment during the massage for this condition. Okay, so for the part 6, which is the self-care plan, okay, self-care recommendations is the increase of fiber in the form of wheat. So you recommend that to your client. Okay, wheat fiber may cause irritation in clients with irritable bowel syndrome. Okay, so if after 3 weeks the omission of wheat fiber is not helpful, a referral to a naturopath is suggested. So naturopath is a specialist that can, for your diet, for some medications, alternative medications, alternative treatment that the client can get. So just refer the client to a naturopath. Okay, it's suggested to refer the client. Okay, and for massage therapists should strongly recommend nutrition counseling. All right, it's very important to suggest that to the client. It is usually necessary because caffeine, alcohol, and smoking can often increase the symptoms of this syndrome. All right, so caffeine, alcohol, and smoking can increase the symptoms of the irritable bowel syndrome. All right, now let's move on to the treatment frequency. Okay, treatment frequency, a 60-minute session. A 60-minute session for treatment, should be once a week for 6 weeks. Right? At that point, the therapist should totally reassess both the client and the remedial exercise self-care. All right? So now let's move on to the expected outcomes. So the prognosis for reading the client of irritable bowel syndrome, get rid of the irritable bowel syndrome, is not particularly good. Okay, so it is not particularly good. It is considered a chronic and recurring condition. So it's saying that even though you're gonna do this in any treatment, massage treatment, the prognosis is not really good because irritable bowel syndrome is a chronic condition or disease. It can go to flare up once in a while. Okay, and client compliance with diet modifications and relaxation strategies has been shown to improve the symptoms. So more of relaxation and diet will be helpful in to improve the client's condition, okay, for irritable bowel syndrome condition. So here you go, guys. This ends our video for this condition. Thank you for watching, and please subscribe, like, comment, and share this video. Okay, thank you very much again, and you have a great day.